In today's episode, we're exploring the fascinating world of iridology with holistic health practitioner Jessica Ortiz. She breaks down how reading the iris can uncover deep insights, not just about physical health, but also emotional and spiritual well-being. We dive into generational trauma, emotional healing, and how this powerful practice empowers us all to take control of our wellness. I had a session with Jessica myself, and she was able to pinpoint key generational patterns and identify which organs need extra support in my healing journey. It was mind-blowing. I mean, surprise, surprise, my gut needs a lot of help. So, if you've never heard of iridology, or if you're curious about how our emotions manifest on our body, then get ready for this episode packed with eye-opening insights. This episode is brought to you by the How We Get Through community, where real transformation happens. Live events, daily meditations, journal prompts, and deep connections with people who actually get it. So hit that subscribe button so you never miss a show. And if you're ready to fully step in, join the How We Get Through community today. The link's in the show notes. Welcome back to How We Get Through, where we heal, we expand, and we get through together. Welcome back to the How We Get Through podcast. Today we have Jessica Ortiz on the show. Welcome, Jessica.
Hi, Jen. Thanks for having me.
Yes, you guys, this is our second round recording because my computer hates me, but we are back. And Jessica, I'm so excited to have you on the show today because I think you do something really special and something I've never seen before. So you do holistic iridology, right?
Correct.
Okay, tell us what that is.
So iridology is just the study of reading the iris. So I'm looking at the colors, the structures of the fibers, any pigmentations or freckles in the eyes. So those features will tell me if there's a strength or a weakness. And depending on where those features are in the eyes, that'll determine which part of the body has that strength or weakness. So um, by looking at those, I'm able to identify also the emotions that are tied to those organs and systems. And I'll ask the client a bunch of questions. I'm kind of just like the interpreter, and I'm putting those puzzle pieces together to see like what resonates with them. And then from there, the client is able to identify what is coming up either on a physical level, emotional, mental, or spiritual.
And who created it? How did this modality come about?
So there's not a lot of like structured info about
Okay.
this. It's kind of one of those modalities that's been suppressed. But for example, there was this guy, Dr. Ignaz Peskai. I'm totally butchered his name.
It's okay.
And this is one of the more like popular stories that's been kind of talked about in the iridology area. And so what happened was he was a kid and he was outside in his garden and an owl came to, I don't know, they were hanging out and he was trying to like get into his garden, and this kid, he somehow broke the owl's arm, and he noticed that in the eye a feature appeared in the owl's
Wow.
iris. So that kind of stuck with him, and later on, he ended up becoming a doctor in Hungary. So
I'm Hungarian.
oh,
What did you say his name was?
oh, don't ask me
His
again. I
first
don't
name? Edgar? No. Did you say something like that?
Ignas. Ignas?
Ignace.
Yeah.
Okay.
So he started studying medicine, and when he was practicing, he started reading the irises of his patients. So that's kind of how he's just one example, but that's kind of how the evolution of the eye chart came about. A lot of healers, a lot of physicians back then, they would just, based on uh, the symptoms from their patients, that's kind of how they started like collecting data. Right? So, like, a lot of people would come in with respiratory issues. So they would look at their eyes and they would see some specific features, maybe like web-like features, which we now see as, a weaker feature in a specific part of the eye, right? And then the more and more they saw people with similar symptoms, they would look at the eyes and see that they're having similar features in the same part.
Wow.
So over time, they were just collecting more and more data and adding to the eye chart and stuff like that.
And the eye chart, so I obviously it's a circle, right? Is it I think about like astrology birth chart. It has like 12 different houses. How is the eye chart kind of broken up?
So like let's start at the pupil, right? Right outside the pupil is the gut reflex area. Okay. And then there's a blood vessel that separates the gut reflex area from all the other parts of the body. So when I'm reading the client's eyes, I kind of start I like to start with their constitution, which is just like overall on a physical level, the way their body heals and resists illness. And we start with that framework that's kind of very broad and general and see how that resonates with them. See, it's kind of like a spectrum, like weak constitution and strong. Most people are in the middle, but that gives them a lot of info on how their physical vessel is built. So we kind of start there and then I'll start pointing out, interpreting, finding different features that kind of are like more in detail.
Mm. And what are you looking for? What is it like? What does a strong constitution look like in the eye, and what does a weak one look like? And is it in the
So
gut area or is it where in the
it's
chart?
everywhere in the
Oh,
eye. So when I'm looking at the constitution, I'm looking at both eyes. And if they have more like stronger features or if they have more like weaker, it's more the constitution is more focused on the structures of the fibers, right?
okay.
So the more uniform they are, the more symmetrical, if there's a lot less like openings or web-like features, stuff like that.
Got it. Okay. And then you would go to the gut first and go out after you have the constitution, or you just kind of pick up different things?
So that's a good question. Um, Honestly, I I rely on my intuition
Uh-huh.
to see which features are more prominent and stand out. And it also depends on what the person's intention is with coming to see me. So if they're more focused on, the physical aspects, I do encompass all like spiritual, mental, emotional, and physical during the reading. But if they're gravitating more towards the physical stuff, then I'll focus on, you know, the weaker areas. But a lot of the times I'll ask them what they wanna know, and that's kind of where we start off.
Mm. I love that because it feels tailored to that person and, you know, their structure, but you guiding your own intuition, cueing into them, I think is really important. And I think is really healing on a certain level where you can be really connected with someone um,
Yeah.
and be able to kind of guide them in that. So that's really beautiful.
Like, a lot of times, I'll start off the session with telling them, the features in the eyes, they're from the last 5 generations. So,
Wow.
just how we inherit strong and weak organs and systems, we're also inheriting the emotions that are tied to them. And what's funny is now looking back in the 2 years that I've been doing this, people with similar features and similar experiences come to me in waves.
No
So
way.
and they don't know each other. I've never met them, and it's always now looking back, I'm like, "That's nuts." And when I was starting out, I wasn't aware,
Right.
right? So, I start off the reading with the generational, right? So they're like so that kind of is the icebreaker, because then clients have told me that it puts less pressure on them.
Like, it's not them that's fucked up.
Right.
It's
It's
generational.
just like, it was passed on to me, it wasn't
Yeah.
my fault. I always tell them so back to the, like, people coming to me in waves and, like, using my intuition, right? What has come up in the last maybe, like, month and a half is a lot of people saying that they feel very detached from the emotions that are surfacing. So then we reference, like, this little poster that I have that has the picture of them and their last, 62 ancestors that they've gotten these features from. And I'm like, "You know what?" So that kind of, like, narrows down the questions that I'm now starting to ask them, and then depending on their intention with the reading and where they are and, like, how receptive they are to maybe hearing the more spiritual stuff, I'll ask them or I'll tell them if there's ever a time that a certain feeling or emotion is surfacing that you feel disconnected from, that you feel detached from, it may not be yours. It may be from one of those 62 ancestors. And they're just like, you know what? So, especially the people who I tell that to, they'll stay in contact with me and they'll, like, email me and or DM me, and they're like, "You know what? I've been sitting with that feeling whenever it comes up." And, during the session, we'll talk about it, and I'm telling them, if you're willing to sit with that, it could be a few seconds or a few minutes, and just take a few deep breaths, connect with whoever it is you feel that it's coming from. Let them know, I'm sorry you went through this. I'm feeling a little bit of what you went through. I'm willing to let it go for you. And just like with that breath work, they're like now releasing some stuff that they were carrying that wasn't theirs. So when they email me, they're like, you know what? I've been doing that for like a month. And now it's a lot easier for me to navigate through my stuff that I'm experiencing that I know is mine. And it's a lot easier for me to take accountability for, letting go and stuff like that.
But it's very transformational. Like, you know, in anything, when you're willing to face the things that are coming up and sit with it, like how powerful that can be. It's almost like transmuting that energy of of the past, and then also like, is this mine or is this yours? Which I think is an invaluable skill to have, even for ancestors or, your partner or your kids. Like, is this mine or is this yours? So I think you're also teaching them these really great skills if they want that too.
Right.
What happens so in the eye, can you see like cancer? Can you see like, oh, you usually have ailments on your left side or bad knee problems? Like, are there things that you can kind of point out there?
So thanks for asking that because disclaimer, we don't diagnose. There's no diagnosis in iridology. There are some people out there that I think it's more like old school that they see certain features and it's like, you've got parasites. Like this feature means that you have parasites. I don't go that route because I don't want when somebody say you came and saw me and I was like, "Jen, you've got parasites." Like, what's the first thing you're gonna think or feel?
Afraid.
You're gonna right.
Yeah.
And I'm not here to fearmonger, right? If I do see a weakness, then I'll show them in the eyes. I have posters of other examples of what that looks like in different colored eyes. So that kind of puts that person at ease too, that it's not just like, oh, it's just me. Like
Yeah.
it's common, right? And it's also very much like this is the environment that maybe your gut you were born with. Okay. This is the level of where it's at. Okay. Obviously, their lifestyle is going to determine what symptoms are going to come up, or maybe later down the line, if there's a lot of acidity, if there's a lot of inflammation, that kind of environment is going to be awesome for parasites, for, sluggish bowels, stuff like that. So again, it's a lot more just like what the person educating the person in what their strengths and weaknesses are. And so then they could reflect on what are their eating habits, right?
Right.
Are they holding a lot of stress in their gut? Okay, because that's going to determine a lot of stuff too. And then what are they willing to change? What are they willing to give up? If they want to focus, what is it that they're wanting to focus on? More on what they're eating or more on releasing? Because on an emotional level, the gut is related to letting go of the past and feelings of unworthiness.
Right.
So, um, again, it's just like what the person is ready to hear depending on where they are. And it's just gonna different things are gonna resonate depending on where they are on their, like, healing journey.
And what I like about this modality, I mean, it's not similar to tarot, but I think when people have like a physical representation of a feeling or of an ailment or spirituality, like all the things that you can't see when there's a physical representation of it, it feels a little bit more tangible and a little bit more real, and you can even sense into that, like, "Oh, I can sense into my gut that I have fear around X, Y, and Z," or that I get acid, I get some acid reflux. So I think it's that physical part that grounds the energy and grounds the emotional, the spiritual piece that can keep people a little bit more open because it resonates. It's not just something random you're pulling and saying, "Well, you were abandoned in your childhood," you know?
Right. Exactly. Because like,
Yeah.
a lot of times I'll ask them, there's a feature in the kidney area, and the kidneys are related to forgiveness, okay? So that's very general, right? And then I'll see it, say, in their, left eye. So I'm like, "Is there any unresolved forgiveness towards a female?" And they're like, "Duh."
Yeah.
Right? Everyone has that, okay? But, if you pair that with the features in their gut, you know, perhaps they have a prolapse in their transverse colon, okay? So on an emotional level, that's like related to like feeling weighed down with emotional stress. Okay? So now we're starting to kind of get a little more specific. And then that is what kind of sparks their, memories and see what resonates with them the most.
Yeah, it's so cool. I mean, I can imagine for you, it's like putting together, like, a story and a puzzle.
Exactly.
Fun.
Mhm.
How did you get into this? Did you have your own eyes read first?
No. So, I kind of just stumbled onto this. So, I've only been doing this for a couple years now.
Mhm.
Before that, I was doing speech therapy in schools.
Wow.
So, I did that for, like, 7, 8 years, and I was working in schools in the school system for, like, 15 years.
Thank you for your service.
Thank you.
Shit. Was
Um,
not easy.
oh, hell no.
No.
It was like the Matrix
Mhm.
of the Matrix.
Yeah.
It
Oof.
was so, like, that's all I knew. That's what I went to school for. That's what I got my license in. Um, so in 2021, when all the COVID stuff was going on, they asked me to get the vaccine, and I politely declined,
Yeah.
and I put in my religious exemption that got denied. I ended up getting fired because I just didn't get it. So that
Isn't
was
that illegal?
just a little. Yeah, I've heard.
Yeah. Okay. You should Google that. Yeah, but what are
Yeah,
you gonna do, like,
right.
and doesn't sound like it was a good fit anyway.
Yeah, you know what?
Mm.
There were a lot of signs
Mm.
coming up that I just even before I ended up getting fired. A lot of signs where that were very obvious that I needed to leave.
Yeah.
Okay, and they were just becoming more and more obvious the more I stayed. And I just started getting it got to the point where I was, like, physically getting sick too. So, so that was December 2021 that I got let go. January a month later, January 2022, I had to renew my license. And I was like, "Okay, this is the ultimate test, right? If I'm gonna go back or if I'm gonna stay here or if I'm just gonna, like, throw it out the
Yeah.
window." So, I have a 10-year-old, and he was just, like, not with the masks, and he had been asking me to homeschool him for so long, and I was like, "I how am I gonna do that? Like, I'm working."
Right.
So, um when that opportunity came up, I was like, "Okay, perfect. You're getting your wish." I pulled him out of the private school he was at. He was loving it. Um,
Oh,
but I was just at a point like, "What?" Like, I don't know anything else. Speech was all I knew, and I obviously didn't wanna stay there, and I didn't want to go into, like, a private practice. And I also didn't wanna go into, like, the medical scene either. So, I just thought, "Okay, the money that I was gonna put into renewing the license, I'll put it into a business." So,
smart.
uh, I was like, "God, just put me where you need me
Yeah.
because I have no direction right now." So, it was just, like, complete surrendering.
Yeah. Mm,
So And it was a lot of, like, reflection too, like, who am I if I don't like, other than speech, right?
right. Yeah.
So, lots of reflection and just realizing that I did have other skill sets that were in, like, the health and wellness, because a fun fact, in my early 20s, I was going through menopause.
What?
Yeah.
How
So,
old are you now?
I'm 37, I'll be 38 next month.
Happy birthday, Capricorn?
Thank you.
No?
Aquarius.
Aquarius. Sorry.
Very detached Aquarius.
Okay. I love it.
Yeah, so I'm like, okay, the specialists at that time were telling me I'll never be able to have kids, all this stuff. I was just going through it, all the symptoms of that. That led me down like this downward spiral, spiritually, emotionally, mentally. Obvious, the physical was already manifesting.
Yeah.
So, on my own, I had to just like get myself out of that hole. So I thought, okay, I was able to do that on my own with no structure, with no like direction. So let me kind of find some structure. So I enrolled into a detox course. And the girl who was teaching it, she was also an iridologist, herbalist. Um, and she would read her client's eyes first before doing any other like blood work or anything with them.
Mhm.
So that's where I was kind of introduced to like different programs and certifications, but she focused only on the physical. So
I
I was
see.
like, all right, awesome modality, non invasive, doesn't diagnose, um, very fun. Um, So I just started looking into different programs, and that's where I found Dr. Pesek, where he was like, "No, we're gonna do it all." And rather than, "This is what I see, this is what's wrong with you," it's, "This is what I see, let's look into it together. What does this mean for
For
you?
you.
And what can we do moving forward?" Um, so Yeah, so I just started it with the intention of just like, let's see where this takes me and just like, God, you put me where you need me.
Yeah. So you were homeschooling while building up the iridology business and or doing the
I'm
certification?
still homeschooling, yeah. So,
You're still homeschooling.
yeah,
Thank
this
you
is like
again for your service.
thanks.
Yes. How fun,
It is fun. It's
right?
nuts,
Okay.
but
I
it's
could never.
wild.
So I appreciate you
Yes, you
and
can,
your
yes.
personality. Oh, oh my
And it's like
gosh.
my son is wild and he's an athlete too. So I just, even that world,
Yeah, that's
um,
crazy. Have you read his eyes?
mhm.
That's so cool. How has that helped you as a parent?
Oh gosh, that has made life so much easier because before that, little mannerisms, especially like personality stuff would come up and I'm like, "Oh, that's me."
Yes.
Like, I'm sorry to my parents. Cause now I'm experiencing it or like other stuff and I'm like, "Oh, that's your dad."
Yeah.
Um, so he was there with me as I took all of my, like, certifications, all those levels, and because he was home with me and I was homeschooling him, he went through that with me. He listened to all of it, so he was learning alongside me. So, he would always tell me, like, "Look into my eyes, what do you see?" Like, stuff like that. He's also very curious. So, I'm I obviously wasn't like, "Do you have forgiveness issues
Yeah,
with your
yeah.
dad?"
Yeah.
Like, at that time,
Seriously.
he was, like, 8 years old, right?
Yeah.
So, it was very much only the positive, um, you know, because we kind of started that journey together, the homeschooling and the iridology. Um, I was implementing a lot of stuff that I saw in his eyes into just, like, life skills at home.
Damn, girl, you're good.
So I need
Yes.
structure in my life
I
or else
love it.
it's just chaos.
Yeah. I love that though.
Yeah, so I'm like, "Okay, let's start a garden. Okay, here are your planters. One is for herbs, like medicinal herbs, and the other one is just like for flowers. This is your responsibility. Every day, incorporate that into your morning routine." Right? So now, um, you know, little by little, based on the weaknesses, it's all preventative right now, right, in his head. Um, what he's now starting to build his toolbox, right?
Right. Yep.
When he feels there's a lot of self-awareness there. So when, he starts to, I don't know, get the sniffles, he already knows which
Herb.
herbs he needs to make an herbal bath.
Oh my god. How
So,
cute is he?
it could be like so simple.
Yeah.
Like, and I'm all about simplifying everything. So, um, when, he's very bright, so he does ask, like, there's something you're not telling me. Like, what is it on the emotional level with
Damn.
you? What did you give me? Or what did I get from dad's side? Stuff like that. And I'm just like, okay, you know, the brown freckles are liver. Okay. So that's anger and resentment. Okay. Now you look for them. You tell me if it's in the left or if it's in the right, you know? And they're in the right. So that's unresolved um anger towards dad, right? So now I'm also teaching him to like just be aware of those things, okay? Give yourself grace when those emotions do come up, when you do experience maybe situations that have anger involved, right? Reflect first and don't be like reactive, right? little things like that. So he loves it.
Yeah. I mean, what I'm hearing you teach him is, again, this attunement to himself, like physically and emotionally, mentally, which is obviously we don't get taught that at schools. We might not get taught that at schools, actually, the opposite. But I think a lot of parents, especially our age, are wanting to have that for our children because we are starting to do that for ourselves. So I think it's a really valuable skill. And again, it's rooted in something physical or kind of scientific. So it feels very grounded. It doesn't feel weird, you know,
Right.
which is so cool.
Yeah. And it just brings like certain things into perspective, right? It highlights, like, upon reflecting and knowing what you do know, um, based off of certain features and the emotions that are tied to it, then you're able to highlight certain relationships that we've had where that emotion was like the common factor,
Mhm.
right? And
Yeah.
kind of go back, um, see what the lessons were there. Give yourself grace for doing the best you could with the knowledge that you had, the resources that you had, the support that you had, right? And then it's going to be a lot easier to navigate new situations as they come.
Mhm. Are there things that can change in your irises? Like, do you get more freckles over time, or do you get different webbing or anything like that, or does it usually kind of stay the same?
So the features that we're looking at, we were born with those.
Okay.
Okay. So if there were to be any changes, I don't want to say no, nothing changes because that's a limiting belief, right? Everything's possible. However, if something's going to change in like the structures of the fibers, it's going to be very, very hard to notice just like with the naked eye, just like looking in the mirror, right? Some stuff that you will be able to see or that are more noticeable are in the whites. So in the sclera, okay? You could see blood vessels, right? Or you could see if we have like a yellow tint, that's more liver signs, right? So if you were to have maybe a lot of like primary blood vessels, the ones that are a lot thicker, and you do, you change your diet, you do some cleanses, detoxing, maybe within a month, those will kind of recede and the eyes will appear brighter,
Brighter.
right? So, little things like that. Um, but most people, they know when there's changes, right? So I try to focus a little more of like going inward rather than just like trying to track progress, like visually.
Yeah. And what, like, transformations have you seen from doing these readings with people?
It depends because I see some people come to me who are like, they've never heard of it, just do personality, right? So that kind of like sparks their, I don't know, it's like it highlights like their strengths, right? And it kind of just like reconnects themselves with their physical vessel. Other times people are like, I've gone to acupuncture, I've done colonics, I've gone to the chiropractor, something's still off, okay? And they'll come to me for more like the spiritual, mental, emotional part of it. So once they start, um, you know, tying that into their morning routine, into their nighttime routine, once they start setting intentions with the acupuncture, with the chiropractor, pairing those, then they see a lot stuff, it's more effective, right? Um, some people are just like, I know what the issue is. Do you know anybody else, or have you tried another modality that can help with this? So then I'll send them to like, I don't know, like brain balancing type of stuff, something that also is not very common that people know about. Um, so yeah, it just depends. And but I feel like tying in the spiritual, mental, emotional part to their physical ailments or symptoms, that alone just makes like a big difference in their confidence, in their ability to trust themselves and looking inward versus like looking outward for other people to fix them.
Right, which it's, so interesting. I'm hearing you teach your son this like internal skill, and it sounds like you teach your clients the same thing. Like this is an external thing that's the doorway, but internally, what is happening for you? But when you ask them the questions, you get them, you're kind of like leading them, but also guiding them to trust themselves. Like, does that sound right for you,
Right.
or does that feel good for you? Which I think is so helpful for practitioners or for guides or for therapists, for anybody. Like, we don't have all the answers. You have all the answers, or they have all the answers. And we just kind of ask the questions or open the doors to that.
Right. And it's like just reminding them our bodies know how to function, our bodies know how to heal. Okay. They don't need me to tell them what to do or how to do it. Right? I'm
Yeah.
just maybe guiding them based on what I see, what we see together in their eyes, and I tell them, like, what it means, right? Those features, and then I ask the questions. But what is it that they're doing or not doing that's giving their body a safe space or an unsafe space in order to function properly or to heal? Okay. Is it something internal, right? Is it looping thoughts? Is it negative self talk? Stuff like that. Is it external? Is it the people that you're around that you maybe, need to set boundaries with? Things that are very simple to think about. It might be harder for some people more than others to set boundaries and stuff like that. But again, just simplifying everything around us, right? When we get rid of that external chatter, it's a lot easier for us to be aware of the signs, messages, cues that our body's trying to give us.
Mhm. Right,
Mhm.
exactly. And are there some people that use iridology for like, I'm going to tell you the future of your life? Or do they like, number one, is that possible? Number two, do they like abuse it in like, or like spiritually manipulate it that you've seen?
No, I haven't seen that.
Okay.
Thank God.
Yeah, I'm like, great.
Um, yeah, you know what? I was
Mm.
at so these features don't we can't see what's in the future. Okay? This is not that type of reading. Okay? If we see maybe a part of the body that needs a little more help, okay, we could assume that if we have self-destructive behaviors in the future, that's going to lead to,
Yes.
an illness or dis-ease, right?
Yeah.
But um I've found that a lot of people are just so fixated on like the future, right? Hardly anybody is living in the present. Okay.
Say that again. Yeah.
So again, trying to highlight that. What is it that you're going through right now? Is that sustainable? Right? If you already have um an insight of what things could be like 20, 30 years from now down the line, um what are some things that you could do now to help prevent something from manifesting later?
And that's empowering for them. And then they decide yes or no
Right.
versus saying this will happen to you in 20 years if blah, 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 blah.
Exactly.
Yeah. That's really cool. And you've worked with veterans as well, right?
Mhm.
What has been your experience there?
That's been so rewarding.
Mm.
And funny story, that was never on my radar. Okay.
Right. Are you
Um,
connected to veterans at all?
right. No, like I was, I never served.
Yeah.
Like I have people in my family that have, but I think, you know, they went through some stuff that it was never talked about ever. Okay. And that was like when I was a kid too, they started serving. So, like, and as a kid, I didn't know either what that
Yeah.
meant. So, um, funny story, last year I was at an iridology conference and I met a chiropractor there. And he's also an iridologist. He's been doing this for decades. So he tells me, "Hey, you're new. I've never seen you here. Where are you from? And how long have you been doing this?" And I'm like, "I'm a newbie. I'm in LA. I don't know anybody else who does this." And he was like, "Okay, what are your like 1 year plan, 5 year, like 5 year plan, and your goal for like 10 years?" And I'm like, "Okay." Um, my focus was, or I wanted to focus on families and looking at the features, like generational features. That's what I wanted to focus on. And then based off of my experience, like, in speech and working with in schools, like, working with the kids and their families too, I was like, I
They
feel
need
very
healing.
right.
Yeah.
We all
Yeah.
do.
Yes.
Um, so that's where I wanted to kind of go go to. And he goes, "Okay, yeah, that's cool. You're gonna work with vets." And I was like,
What?
"What?" Like, never thought of that. So, I was like, "Why do you say that?" And he was like, "First of all, they need it, okay? It's non-invasive, okay? You're not diagnosing, okay? There's a lot of stuff there that's been suppressed, and you're gonna help them unpack all of it,
Wow.
but, like, on a mental, emotional, and spiritual level, not the physical, okay?" And I was like, "I've got my own issues. I don't know if I'm gonna be able to handle that." Like, that's a lot of trauma,
Yeah.
okay? And I was just kind of starting. So, I was like, I wasn't in the mental headspace to, like, understand or, like, wrap my head around it. So that was October, and then a few months later, um, he's now become, like, one of my mentors, and a few months later, I'm calling him, and I'm, like, having this crazy breakdown, and I'm like, "I have no direction," and he was like, "Dude, just, like, get it together. Have you started, like, looking into the VA? You're down the street from Camp Pendleton, like, you need to find a way in," and I was like, I forgot about that, what he told me.
You're like, "Oh, shoot, you're right." Yeah.
Yeah, and I was like, "Nope."
Yeah.
So he was like, "Stay focused, okay? Somebody's gonna come, someone's gonna come around and an opportunity. If you're not looking, an opportunity, like, God will send you somebody." So I'm
Yeah.
like, "Okay." So, like, 5 months later, it was May, and I was at a wellness, event, and the booth next to me was, this, um, organization, a nonprofit that helps vets with, like, holistic resources and,
Wow.
like, suicide prevention, and I had no idea that they were there because the way I was seated, I had my back towards them the whole day.
Oh my
So
gosh.
at the end of the day, this guy comes over and he gets a reading and he was like, "All right, this is interesting. we end up having the consultation that following week, and he's like, "Okay, this is legit. Um, it resonated with me. I think this would help veterans, and this is my organization."
Oh my
And I was next to
God.
you the whole day. And I was like, "Oh," and I kind of blanked out, and I don't remember what else he told me because 'cause I'm just, like, thinking
Shocked.
of that chiropractor and, like, all the stuff that he had told
Oh
me,
my God.
and I was like, "Alright, let me," I always pray on it and always think about it before I make a decision,
It's
right?
good.
So I'm like, but obviously,
Yeah.
how more obvious could it be? So, yeah, that's kind of how that started, and I would
Wow.
just go to events with them, and I was their activation. So,
That is so
yep.
cool. Again, thank you for your service.
Thanks.
Okay, so what does it look like to work with you? Like, can you walk us through what a session looks like?
Yeah, so it just depends. Again, I have different offerings. So my 15-minute readings, a lot more general. We talk about the Constitution, right? How their body's wired, what they have in place already, if anything, what they're doing, and what they could do moving forward. And then I'll maybe pinpoint like one or two features and ask them about that.
Got
And
it.
by that time, it's just like the
I
15
mean,
minutes just goes
yes.
by
Right.
super quick. The 30-minute readings, we do that, but then I use that macro lens that I attach to my phone. So I am able to see a lot more features. Um, so they'll get a form with my recommendations
Oh,
for
cool.
like their strengths and weaknesses. And then in those 30 minutes, we do have a consultation based on what I saw. Um, so yeah, and then there's the brief analysis. So that's using the software. So that's like the 20-page-ish report. And then the full iris analysis covers like, I want to say like 140 points of the body. And that's like a 70-page report. So it's a lot of info, but it's more like a lifetime resource because it breaks down each reflex, each part of the body that was analyzed. Um, and then it gives you an overview of that specific organ or system, what it does, how it works, and then it breaks it down into like the emotional aspects too. And then at the end of that like section, it'll give you like herbal recommendations, food recommendations, activities specific to that organ or system. So that's why it's so lengthy. But um all readings start off with like categorically what are the strengths and weaknesses for that eye color. Okay. And then we go on to the Constitution, and that's kind of like the framework. And then we go into detail about certain features.
Cool.
Yeah.
And so with the 15-minute consultation, are you just looking with your eyes and their eyes, or you're taking a picture and looking at it?
So for the 15-minute, I use a light and lens.
Okay,
So it's like a little magnifying glass.
great. Okay.
Hmm.
And then all the other ones, you're taking photos
Right.
with it. Okay.
Hmm.
And so do you do that virtual? Do you do that in person? How does that work?
So I do both. When I do public pop-ups, I offer the 15 and 30-minute options. And then when I do private, it just depends on what like the owner of the business wants to focus on. Most of the time it's just like the 30-minute. Or sometimes I've had um, like the owner of a colon hydrotherapist have her friend and her family come in, and I took my Nikon in there, and that was just strictly full iris analysis. So I'll just take their pictures, and then everything else is done remotely. I'll email them the reports, and we'll have the consultation on Zoom. But I also have the virtual options too, where I send you the instructions on how to take pictures of your eyes. And then you just email them to me. I send you the form with all the findings, and then we have the consultation on Zoom.
Oh, that is so cool. It's like an acupuncturist and something else.
Right. Yeah, but it's
Iridology.
non-invasive. Yeah.
Yeah. Right, right. But there's something mystical about it too. Like that's like
Right.
scientific, but then also mystical. And yeah, I just love that it hits everything. It's just so fascinating.
Yeah, and it's so cool to see people's reactions when they see their eyes, like, so up close,
Yeah.
and they're like, "I had no idea that was there this
Mm-hmm.
whole time, but it's been with me all my life." And then there's a part of them that it's just like, um, again, just, like, reconnecting to themselves, like, on a physical level, um, because we're always or we've just thought of the eyes of just, like, being able to see,
Right.
right? But then when we look at it in detail and the colors and, like, the structure and stuff like that, it just, like, blows their mind. So and they just have, like, this renewed sense of, like, appreciation for a part of their body that they never looked at it in that way.
Yeah. It's like
Mhm.
being in awe of it because it's
Right.
like it almost to me, I mean, I haven't seen it up close, but it feels like space in some way. Like
Yeah.
it's very vast and with every corner there's could be something new, but you don't know because it's so the perspective of it is always so small. And then when you get in there, you're like, oh my God, this all exists here?
Yeah, and they're like, "What does that mean?"
Yeah.
And, so then I'll bring up, other posters so they could see, what other people's, like, where that reflex area looks different, and they're like and I'm like, "Okay, well, this is what it means," and they're like, "Wait, yeah, I had this experience," and I'm like, "See, this person, it's different in theirs, they're gonna have a different experience from
Yeah.
you."
So you feel special in that and unique in that too.
Mhm.
Mm, that's so cool. Okay,
Yeah.
I cannot wait to do a reading with you. So let's
Let's
do
do it.
it. Yes.
Yes.
Can you tell people where to find you and how to book a session with you?
So I'm on Instagram. My handle is Iris by Jessica Ortiz. So that's where I put a lot of my info for pop-ups, the public pop-ups. I don't do the private ones just because it's like limited availability. But my website is also in the link in my bio. So that's where they could book if they want to do something remote.
Perfect.
Yeah.
Awesome. And we'll put all that in the show notes as well.
Cool. Thank you.
Yay, Jessica, thank you so much for coming on the show. I'm so glad we got to record the second round. We did it. And so excited to keep in touch.
Thanks so much for having me, and
Of
I'm excited
course.
to do your reading too, see what we find.
Thanks, girl. We could do a little part 2 and be like, this is what happened.
Let's do it. Yeah, that'll be fun.
Yay. All right. Thanks, girl.
Thanks.
Bye.
Bye.
Thank you so much for listening to our show. If you are loving what you're hearing, give us a review up on Apple Podcasts as it helps our show grow. And we'll see you next time.